There are so many different types of injuries that can cause pain in the back of your heel. So in this video, I'm going to share 10 of the most common ones that causes pain there. And to help you figure out which one is your case, I will share the most common symptoms as well as how they typically start, because that already tells you a lot about which one of these injuries you may have, and then what the best evidence-based treatment is for this type of injury. I will put links in the description of this video because we've also made videos about most of these conditions in the past where we really go into the detail of diagnosing and treating them. So have a look at the description of this video if you want those links. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment of any type of Achilles injury. So have a look at the description of this video if you want a link to our website. Like I mentioned, I'm going to discuss 10 different conditions in this video. So if you want to jump to the chapters, I've also put chapters in the description of this video where you can find them. Now, first we're going to look at the different injuries that causes pain mostly in the back, straight back of the heel. And the first one we'll look at is Achilles tendonitis or tendinopathy. This is an overuse type injury of the Achilles tendon itself, and where you feel the main pain is either in the mid portion of the tendon or where the Achilles tendon attaches right onto the heel bone. Now, this injury starts gradually. It can either be during one training session that the pain builds slowly during the session, or it can be over several sessions that it builds slowly over that. It may also be that you actually don't feel anything during the session, but several hours later or the next day you go, oh, why is my Achilles tendon so painful? Achilles tendonitis does not start suddenly or like, oof, what was that? That's something different. This type of pain builds gradually over time. Now, what's the best treatment for this? It's a mixture of relative rest, and you'll see that this works for most of the injuries we're going to discuss. Relative rest means that you reduce the aggravating activities, so it matches your tendon's current strength and capacity, so it doesn't get worse than what it is. So that allows it to calm down. But then you have to rebuild the strength, so that's why strength training is the second most important part of the treatment plan. And we've made detailed videos about what type of exercises and things you want to be doing for this. But this best evidence-based treatment doesn't work for everybody, so there are other things that can also be useful. And again, I've made a video about all of those things, so go have a look at the link in the description of this one. Injury number 2, Achilles tendon tears. Now, what's the difference? Again, you can tear the Achilles tendon anywhere along the line. It can be at the insertion into the heel bone or mid portion or even higher up. The difference between this and Achilles tendonitis is that you get a sudden sharp pain with activity. So you're walking along or you're jogging along or you're jumping and suddenly it's like boom, what was that? If it's a complete rupture, you often hear a sound that sounds like a gunshot, or it feels as if somebody's kicked you in the back of the leg. But the bizarre thing is a partial tear where some of the tendon is still intact is usually more painful than a complete rupture, because then there's nothing to pull on. So just because you don't have pain doesn't mean that it's not torn. And if you've had a sudden sharp pain or gunshot feeling or something, and it's in the area of the Achilles tendon, get it checked immediately because it needs immediate attention. Now, best evidence-based treatment for Achilles tendon tears, if it's a partial tear, so not the whole tendon torn through, it just needs to be placed in a boot or even a shoe for smaller tears that keeps the foot in a slightly plantar flexed position, so the tendon can have time to grow together. And then you can start your rehab in that position and strengthen it, and it reacts really well to conservative treatment. In our experience, partial tendon tears usually do not need surgery. They can be managed fully through conservative treatment. If you have a complete rupture, so the tendon has fully ruptured or most of the tendon has ruptured, again, you don't always need surgery. If you get to see a medical professional and it gets diagnosed immediately and you get placed in a boot or plaster cast with your toes pointed down, that tendon can actually grow together by itself. And then your rehab process and everything is much quicker. But If unfortunately you didn't get it placed in that position and you've done activities or you've walked on it because it wasn't painful, it was completely ruptured, so you thought it was okay, you didn't get pain while you walked, or somebody put it in a boot in the wrong position, that they actually forced it into a neutral position rather than pointed down. In that case, the tendon can separate too far that conservative treatment can't work because the tendon just can't grow together. And in that case, you may require surgery. But either way, even if you do surgery or you have conservative treatment, you then afterwards have to follow a rehab plan to strengthen it slowly. And we've made videos about partial tears, we've made videos about complete tears, and especially also post-rupture, if you've had surgery, the rehab process. So have a look at the description of this video if you want more information about that. Retrocalcaneal bursitis, or in short, heel bursitis. Wherever you have tendons close to bones, you get little fluid-filled sacs. They're called bursas or bursae. And they are between the tendon and the bone to stop extra friction. But if the friction, or you do an activity that squashes them excessively, then they can actually become painful and inflamed and cause a lot of pain. Now, typical heel bursitis causes pain in the same area where the Achilles tendon attaches, right to the heel bone. And it can often be there in combination with insertional Achilles tendonitis. It's a very common presentation to have both. If the bursa is irritated, you see a lot more puffiness and swelling usually in that area. It may even be red and hot to touch. And the typical thing that will aggravate it more is if you do dorsiflexion stretches, like your typical calf stretch really irritates that. The way it gets injured can be either through, again, overuse, so doing lots of running or lots of jumping and working that area quite hard, or just overstretching, like stretching really hard in yoga, or going into flatter shoes that when you're used to walking in shoes with slight heel and suddenly on holiday you're walking in your flip-flops or your sandals for miles and miles and miles. That's a typical way to irritate that bursa. What is the best treatment for it? Well, it's to stop irritating that bursa. Now, I can't believe how many clinicians tell people to do calf stretches when they have heel bursitis. It's the worst thing they can do, because what that does is it increases the pressure between the Achilles tendon and the calf and the heel bone and just squashes that painful bursa more, causing the inflammation and everything to be worse. The best thing you can do is to stop all calf stretches, put your foot in a shoe that has a bit of a heel on it so it takes the strain off that bursa, and even sometimes people really benefit from putting heel raising in orthotics or just heel lifts into their backs of their shoes to lift that heel even further. The better you can reduce the pressure on the bursa, the more quickly it will calm down and the better for it. So that is the #1 treatment for this and the thing that gives best success. There are other things like anti-inflammatories or corticosteroid injections that can sometimes be useful, but it's not the first line of defense for this. Go and have a look at the video about bursitis, because I've gone into a lot of details about all the different activities you must think about in your day that you need to adapt to really offload that bursa and just give it time to calm down. I always struggle to say this word, but another cause for pain in the back of the heel is a tear to the fascia cruris. Fascia cruris. So what is this fascia cruris? It's a really, really thin layer of connective tissue that goes across all your calf muscles and your Achilles tendon. And the most common area for this to tear is where it covers the attachment of the Achilles tendon, either to the inner side of that attachment or the slight outer side on the heel bone. What does it feel like when you tear it? It's usually that people report that they've had really tight calves for a few days, and then while they were walking or they were going upstairs or running, they suddenly felt a sudden sharp pain in the area, but more like a stinging sensation, like a bee sting or something. Now, this is not an injury that a lot of clinicians are aware of. The only reason I know of it is because I actually worked with one of the sports doctors who identified this and wrote an article about it. I'll put a link to that article in the description of this video. The good news is this is not a serious injury, and it reacts really well to just offloading the area for a period of time, usually about 4 weeks or so, where you wear shoes with heels on them, avoid walking around on bare feet. When I say heels on them, I don't mean high-heeled shoes. I mean like running trainers or running shoes that is just not flat, or even adding heel lift insoles into the back of those shoes to have your foot even a little bit more in that position to take the strain off the area. And then you do want to strengthen it, but you start with low load things like double leg calf raises, moving on to single, so similar to what you would do for Achilles tendonitis. And then you slowly ease into sport once that area has calmed down. It reacts much more quickly to treatment than Achilles tendonitis because this is a tiny tear, and tears tend to actually heal more quickly than overuse injuries like tendonitis. A condition that's often confused with Achilles tendonitis or other Achilles injuries is posterior ankle impingement. What is that? Well, it's basically just something is pinching in the back of the ankle joint and causing pain. And it's easily confused with Achilles injuries because the back of the ankle joint lies at the same level of the Achilles tendon. But this type of pain is not on the tendon or in the tendon, it's more behind the tendon, and it's difficult to pinpoint. It usually starts either through you sprain your ankle, and then as it's recovering, that pain lasts because often people continue to do things that irritate it, or they don't restore the strength around the ankle properly. Or it is that they're doing lots of sports that forcefully plantar flexes and points the foot down, causing the back of the ankle to strain. Typically it's forceful kicking in football, or ballet dancing, going up on your toes a lot and forcing that movement that can cause posterior ankle impingement. What works well for treatment? Well, the first thing is that you have to stop irritating it through going into that range that pinches it. It's like pressing on a bruise. If you continue to pinch it, it's never going to calm down. So even though it's not a serious injury, you have to stop irritating it. In ballet, they find that they get best results if they actually stop doing ballet for 3 to 4 weeks and then slowly ease back into it. There's not a lot of research in other sports, but have a look at the video I made about it because I go into more detail there. But then also strengthening the muscles that control the ankle for better control, and the rest of the body, so that the ankle don't move unpredictably into those ranges. And at the beginning, you may even have to adapt your rehab exercises, that you just stop short. For instance, if you go up on your toes and it hurts to go all the way up, you just stop short of that you don't go quite that high. Then there are specific cases that may benefit from injections or even surgery, but it's not all cases that need it. Have a look at the other video because I go into a lot of detail there, and you may avoid unnecessary surgery if you watch that one first. You have two nerves that run quite close to the back of the heel, your sural nerve and your tibial nerve. Now, they can become irritated in that area, or the little shoots they give off can sometimes become irritated. And typically, if you're feeling like a burning, tingling, numbness, funny sensation around your heel, that indicates that a nerve may be involved. Now, I know I said that the fascia cruris, those tears also feels like a stinging when it happens, but it's just when it happens. It doesn't continue to sting then. If it's constantly giving you these funny stinging things and just you're not doing anything, but it's giving you funny sensations, that's more likely going to be a nerve. Sometimes also that sensation only comes on when you do a stretch or something for the area. So the most common cause for why the nerve may get irritated there is one, that you've overstretched the area somehow. So you've done a lot of uphill walking into strong dorsiflexion, or lots of deep yoga stretching, really forcing the ankle into that position. It can be that also you have a different condition like Achilles tendonitis, and that causes the tendon to thicken a bit, and now it's irritating the nerve a bit. So how do you treat this? Well, you first need to figure out what is actually causing your case, because if it is tight muscles higher up in the body, you want to be stretching them. If it was overstretching the nerve in the first place, you don't want to be doing stretches because you'll actually make it worse, or at least stretches that affect that area directly. What you want to do in that case is you want to avoid the positions that bring on that tingling, and you want to just reduce the irritation for a period of time. Nerves calm down really quickly, or not quickly, they calm down really well when you do that, but they take a very long time. They do not forgive you very quickly. It takes quite a lot of weeks of being nice to it before it starts to show progress. And if you have a different condition like Achilles tendonitis, you have to treat the Achilles tendonitis, but you have to adapt your exercises. For instance, I would then possibly do the heel raises in a limited range, because sometimes then when the patient drops their foot over the side of a step, for instance, that can bring on the tingling more, and that shows that the nerve is getting irritated, and there's no use in irritating the nerve while you're doing it. So in that case, rather do your heel raises to floor level, or don't lift as high, or just don't drop as low. There are loads of different ways that you can strengthen the tendon still, but adapt it for the nerve. One that often catches people out is referred pain from the lower back. Now, why does this catch people out? Because they often don't have any pain in their backs when the back is causing the pain on the heel. The nerve roots of the back refers pain to specific areas depending on, we call them dermatomes. They all supply a certain area of the body. So again, this can cause tingling, weird sensations, or just pure pain in that area. And depending on where you feel the symptoms, that really tells me what level of the spine may be at issue, because a specific nerve always goes to a specific area. How it typically starts is, it may be that you've had a back injury. It may be that you just have a really stiff back. It may be that you're doing activities that's annoying your back, but you don't really realize that that's affecting your heel. It may also be that you've had an old back injury and that there's scar tissue or something that's part of the cause here. Best treatment for this? You have to see a physiotherapist or a doctor or somebody who can assess it for you and figure out what is causing your case, because you want to treat the back. If you're going to try and treat the heel where you're feeling the symptoms to get this better, you're not going to get a result, because that's not where the problem is. That's just where you feel the symptoms. You have to address the cause in the back. And the reason you need to get it assessed and not just go and do random exercises you find on the internet is, if you have an actual back injury, doing some of the stretches and things you see on the internet can actually make it worse. If you have a stiff back, then stretches is brilliant for that. But again, contraindicated for other things. So have it assessed, have it checked what is causing your case of nerve pain, and that will give you the best treatment. When you hear me saying have it assessed, you may think that I mean you need to have a scan. Scans aren't that useful to assess nerve pain because, one, you need to know what you're looking for when you're doing the scan to decide what type of scan you want. Two, not all causes of nerve pain can be seen on scans. And three, you have to scan the back if you're going to do a scan, not the heel, because you'll likely not see anything in the heel if it is nerve pain. The best thing to do first is get it assessed by a physiotherapist, because they will decide whether, oh, actually we do need a scan or not, and which area, whether it's the heel or the back, that needs to be scanned. So if we move slightly around the heel to the outer back side of the heel, the most common cause for pain that you feel in that area is if one of the peroneal tendons are injured. So they are the tendons that turn your foot outwards or stabilize. They've got a very important role in stabilization. Again, they can either have a tendonitis or tendinopathy, or they can be torn. So a tear happens suddenly, same as Achilles, that you either sprain your ankle or you feel a sudden sharp pain, then it may be a peroneal tendon tear. Or if it comes on slowly over time, either during one session or over several sessions, then it's more likely going to be a tendonitis. How do you treat it? Well, one, you've got to figure out what's annoying it, what's making this muscle overwork. So are you wearing shoes that's causing your foot to turn side to side more than normal? That will make it work harder. Are you doing something like, do you have a habit of standing on the outside of your feet while you just standing and chatting to people? That will make it work harder. It can be that you're just wearing old shoes, but it may be the way you walk or something else, some other activity that you've done that you're not used to. So it's useful to identify what is actually causing it to strain in the first place. Second, again, relative rest. Allow it to calm down, limit your activities, and then you want to slowly strengthen it up with specific exercises for that tendon. Link to a video about this is in the description of this video. Now we're coming to the inner back side of the heel. So the Plantaris tendon is the first one we're going to look at. And the Plantaris tendon is a very small tendon that runs right next to the Achilles tendon. It's not even present in all people. And This one causes pain on the inner side of the Achilles tendon, about 6 centimeters above the heel bone. And it's typically more painful with activities that causes forced dorsiflexion, or it's also to do with how sometimes into excessive pronation. Again, you can either tear or get tendonitis in this tendon. It's not that common to tear it. It's usually only after a long period of tendonitis that you tear it. But tendonitis will develop the same as Achilles tendonitis, that it comes on slowly over time. Often, if you do anything that causes excessive pronation or dorsiflexion, that can cause more pain there. So calf stretches and things can cause it to get irritated. But it's really difficult to diagnose or distinguish from regular Achilles tendonitis. And to be honest, I find that it's not that necessary always at the start to be entirely sure if it's the Achilles tendon or the Plantaris tendon, because your treatment is very similar. It's only when it's not really responding to treatment that you may want to get a scan. Now, best treatment for this is if you are overpronating, causing more strain on that tendon as it does that, you may benefit from actually wearing really supportive shoes and orthotics. But same goes for if you've got Achilles tendonitis, that will also help. Again, you've got to reduce your activities to a level that doesn't irritate the tendon any further so that it can calm down. And then you want to slowly strengthen it so that it gets to the point where it can tolerate your sport again. We've made a video about that. Go have a look if you want more detail about this. The tib post tendon or posterior tibialis tendon can cause pain quite high up next to the Achilles tendon on the inner side back of the heel, but then it can also cause pain all the way down back of the heel bone, the inner heel bone, and even in the area where it attaches to the foot bones. It's usually any activity that increases pronation, so the rolling in of the foot, that's going to irritate this, because the tib post tendon is meant to control that. It can be that your foot shape is of that kind, that it rolls in too much when you walk or run. It can be that you changed your footwear, that it's suddenly a very flexible shoe that causes you to turn in more. Or your shoes can just be worn out and they need replacing. Or perhaps you went and did a long hill on a severe camber, causing it to strain more. Tendonitis of the tendon will come on slowly during an activity over several or perhaps several hours after an activity, whereas an acute tear will be a sudden sharp pain that you feel with that. The best treatment for this is a combination. You've got to reduce the pronation for a while, that the tendon can actually have time to recover. So this may mean orthotics in your shoes to support your arch, although they have to be the right size for you, because if they're too severe, they can actually irritate it further. And these orthotics, if you don't have a permanent reason to wear them, you may be able to wean off them again. But if your foot is very flexible and your arch isn't well supported, it may be useful to continue wearing them into the future. But then you also want to strengthen the muscles that support your foot arch, as well as control your ankle, and even higher up to reduce that overpronation. Just be careful not to jump in with those exercises too early, because that can really irritate the tendon further. Get it to calm down properly first and then slowly add them in. Have a look at the video that I've made about this for more guidance on that. The last one on the list is Flexor hallucis longus. Now, this muscle and tendon helps to push your big toe down. So it works really hard whenever you go on your tiptoes or do sports like wall climbing, where you really take a lot of strain on that. Dancers use their big toes a lot. Anything that causes forceful pushing off will work that. Now, the tendon runs, the muscle is actually located in the back of your calf, really deep in the back of your calf, but then the tendon runs close to the tib post tendon. And it can be tricky to distinguish between the two, but this one, often the pain goes in under the foot and a little bit to the big toe as well. So it just depends on how far that pain runs along the tendon, and your physio will also get you to do different tests to see if they can isolate the big toe movements from the ankle movements and see if that makes a difference. It also helps to stop overpronation. So any activity that causes you to overpronate excessively can also contribute to straining that. And it's not uncommon to have both your tib post tendon as well as your flexor hallucis longus tendon angry at the same time because the same activity irritated both of the tendons. Treatment is very similar to tib post tendinopathy. It's if you're overpronating, pick good shoes, see if orthotics help. Taping can even help to just stop that heavy overpronation. Offload the foot through reducing your activities, the amount you stand, definitely cutting out that movement for a while, or how much you push with your big toe, and then slowly strengthening it over time once it has calmed down enough to regain your strength in it. And especially for dancers, it's useful to check if you actually need to change something in your technique as well to not overstrain this in the future. Brilliant. That was a super quick discussion of all of these injuries. So like I said, go have a look at the description of this video. There are detailed videos about this, but hopefully it's given you a slightly better idea of where to start, what could be wrong with your heel and why may it be hurting. Now remember, if you need help figuring this out, our team can assess any type of ankle injury or Achilles injury or heel injury via video call and provide a treatment plan for that as well for you. So have a look at the description of this video if you want a link to our website. Take care.